If possible, when I'm working on the posterior neck, I'd like to use, probably about 3 towels or so. As I roll those up, the diameter should be approximately 5 inches. So then I'm going to place this at the upper thoracic below the C7. This is going to feel uncomfortable for a couple of minutes. And what ends up happening is that through mechanical correction, it helps to correct the thorax as well as allow the head to naturally sink back in its correct position. Now, the neck has a 63-degree cervical curve going backwards where it should be. So that's going to allow me to slowly work those extensor muscles and to encourage that natural curve to come back. Normally in this position, I would be sitting on a stool or a chair. I like to use my thumb in this position, and I would start off with supporting the person's head, and as I'm stroking down, I slowly lower the head. That encourages that movement to come back and to release those stuck facets. I'll probably start just lateral to the spinous process. As I'm slowly clearing those areas out, then I'll be moving more laterally. There's probably a good at least 5 layers of fascia to get through, so you can't really rush this. And if you happen to feel any kind of restriction or kind of an issue, instead of continuing, I will just apply that static pressure and I will wait for it to release. In some cases, I have to change the angle of the head to provide a little bit more tension. And then all of a sudden that fascia level lets go and I continue on to the next level. I don't ask the person to do this at home because I don't want them to fall asleep like on the edge of a mattress or to place their own support underneath their thoracic. It's better to do just in a treatment setting, and all of a sudden the person will get up and they'll feel totally different.
Supine position, encouraging that extension. Ooh, right there. That's about C2 or C3 is pushing back this way, so I'm just kind of pushing it back the other way. So whatever you prefer to use, if you want to use your knuckles, fist, thumb, fingers, it's nice if you can give them a little bit of a stretch while you're working that. So the extensor muscles and trapezius, they help to extend backwards. So the opposite is flexion. So first of all, if you could bring your chin to your chest slowly and then raise up. Okay, good. And then back down. So I'm going to have my fingers like this on either side of the vertebra. I'm going to push up first. Now bring your chin to your chest and then slowly look up into flexion while I'm working that. Probably better to go down. Let me try that again, but I'll go down. Okay. Okay, so chin to the chest and then look up. Okay. Suboccipitals, turning the head a little bit, and then now getting back in there and now treating those again. So cross fiber friction, go north and south, anyway, ooh. So just going to hold that spot because I just know that that's a good one. Her body temperature increased about 2 degrees just now. And it's like you can tell. Ooh. Do you talk a lot on the phone?
Mm-mm.
It's always on the left side when they talk on the phone too much.
I'm left-handed.
So the action is extension. So have them nod. So bring your chin down so it's just like that. So very small, not your neck, just your head. Okay, again. Just keep nodding down. Oh. This is some of her worst. And then the other side so everybody can see. So just nodding down. So north and south or east or west? Pressure okay? Mm-hmm. Okay. The transverse, intertransverse ligament. The anterior part of the deltoids are in front, the trapezius. I'm in front of trapezius, push down to the rib, maybe a little diagonal, and you're into C7, and then cross fiber. It's not as bad, is it?
It's tender.
And just follow the ear line going up. Other side, in front of trapezius, push straight down to the rib. It might take you a few seconds to get there. Take it slow, it's sensitive. Cross fiber going up. Okay. Dowager's hump. So you're pushing up and you're also going down like that, or you can go the other way. So push up and then go up. So we want to encourage this extension back and through here to take pressure off of C7. So I'm going to push right at C7 and then come back down slow. So now bring your chin to your chest and then flex back up and then come back down. So she's coming back down in extension while I've got that pressure there at C7 and C6. So I'm pushing up as she's extending backwards against me. So we get the motion going first, then she's actually pushing back down as I'm putting that pressure up. So it really encourages this to let go.